We begin with some of the bad news. Massachusetts passed the 500,000 confirmed cases mark today on the one-year anniversary of the first diagnosis in the state. And a nor'easter is settling in just as people aged 75 and older are now eligible to get the vaccine in Massachusetts is further complicating an already troubled rollout. The state has fallen to 41st place in the percent of people who've gotten at least one dose of the vaccine, per the Washington Post. Many are frustrated that officials aren't opening up more appointments now, making appointments further ahead, or will even say when the next phase might begin. And once again today, Governor Charlie Baker blamed the limited number of doses the state gets from the federal government.
How many people have had first doses? You need to budget slots for the assumption that those folks are coming back for second doses, right? So that has an impact on when you can actually be able to make first doses available for people who are in the next group.
But just this morning, the Biden administration appeared to caution against that approach.
We believe that some healthcare providers are regularly holding back doses that are intended as first doses and instead keeping them in reserve for second doses for patients. We want to be clear that we understand why healthcare providers have done that, but that it does not need to happen and should not happen.
So might that mean Massachusetts will rethink its strategy? For those who've spent days camped out on the state's website trying to score a coveted appointment, easier access can't come soon enough. I'm joined now by Jodi Scarbrough, who's been trying to schedule appointments for her in-laws on the Cape to get their first vaccine doses, and the state senator for the Cape and Islands, Julian Cyr. Jodi, Senator, thanks so much for joining us.
Good to be with you.
So, Jodi, starting with you, are you helping your in-laws just because you're a good daughter-in-law or because they couldn't manipulate or maneuver the system themselves?
I think for two reasons. One, the system was incredibly difficult for them to navigate, mostly because it's set up in a way that you have to go through many microsites in order to determine availability. And second, hopefully it's because I'm a good daughter-in-law. And thirdly, it's because the time that they are released, often the openings are at 1 or 2 a.m. in the morning, or so everyone told me.
Yeah, and my understanding is you're not alone in this. Your brother-in-law has been doing this too. Do you have a rough estimate as to how much time you and your brother-in-law have spent trying to get your in-laws an appointment?
So since last week, Thursday, I've probably spent around 6 or 7 hours, and he's on the West Coast, so he takes on, a little later in his day, but at least not as late as me, probably around about the same amount of time.
Senator, if I can bring you in, what do you say to those, and I don't just mean those two people, but all of the people we've heard on the radio, from scores of them, who say, I just can't do this. And by the way, a lot of people are not lucky enough to have a kid or a kid-in-law who's willing to spend this kind of time. What do you say to them?
Well, exactly, Jim. I'm really worried about the Cape Codders and Islanders who aren't, fortunate to have someone like Jodi who can help them navigate what is a clunky system that so far we've had really poor communication and not good messaging on. And so what we're trying to do, look, there's a broader supply challenge going on, but there's still a real communication and messaging issue. And what we're really trying to do is say, all right, how do we work in a constructive way to get information out to our constituents? So what we're doing in Barnstable County, which is here in Cape Cod, we're proactively reaching out to 50,000 adults who are 65 and older. We'll be doing a briefing on Wednesday evening, actually at 5:30, to walk through everything that we know, right? We're not controlling this, but everything we know, and then answer questions, because this has been really frustrating. Nerves are frayed, and they're right to be.
But respectfully, Senator, when you say there's a problem with, what the feds have supplied, a state senator in 50 states could say the exact same thing, yet 40 states have dealt with the federal shortage better than we. Sometime this week, I believe, correct me if I'm wrong, the governor said that sometime this week we'll have a call center, which it seems to me, particularly seniors who don't have a daughter-in-law are going to need. When that call center, I don't know why it wasn't set up ages ago. When that call center is set up, will the person on the other end of the line be able to make a specific appointment for the person who's calling in?
I sure hope so, because that's what our constituents need and what they deserve. There is. Look, I mean, this has been a breakdown around communication. I think that Massachusetts had a robust vaccine strategy. We tried to, and there were some things in this vaccine strategy I think that were really important from an equity perspective, putting home health aides and others first. But particularly once we've gotten to this point, particularly in that last week, just both the systems through which people are asked to register and the fact that it's so difficult to navigate and communication has been so mixed, it has just created just so much frustration. And I feel it too. I mean, people are looking to me as the state senator for answers, and I don't have many. I don't have much more answers than what's publicly available.
Well, I appreciate your candor. I appreciate you seemed. I don't want to put words in your mouth, but when I just asked you if someone calls that call center, whenever it's set up, will they be able to make an appointment? You're an elected official in the state. You're not sure they can. Is that correct?
At this time, I'm not sure of the specific details. I sure hope they can.
I hope so too. So, Jodi, let's not leave people in suspense. The second before we started this interview, you shared some good news with me after your brother-in-law and you spent a lot of hours. What happened?
So I think it's very much a not what you know, but whom you know. So I live in Lexington, Massachusetts, and through one of our local Facebook groups had been bemoaning how difficult it was to set up appointments or even to find out more details on when to. And someone reached out to me to say that her mother, in fact, works out of Cape Cod Community Hospital, and she is responsible for scheduling at Melody Clinic. And so fortunately, me coming from this lovely affluent area of Lexington, met some other fabulous person who could put me in touch with her mother, who could then directly schedule me this week for my in-laws. So, I think it was, and in one way, I'm extremely grateful for that. In other ways, it's the level of frustration for people who don't have the ability to navigate complicated systems or have the right people to reach out to. I think that's extremely, there's a healthcare disparity there that we have to address.
I'm really glad you said that, Jodi. Back to you, Senator, for a second. I think you heard at the beginning, we played the governor saying he wanted to make sure we reserved enough shots for second doses. And Andy Slavitt, who's one of the people running the deal for President Biden, saying don't hold those first doses back. According to the CDC, we checked this morning, roughly 1 million doses have been sent to Massachusetts, and a little short of 600,000 have been in people's arms, meaning 400,000+ are in freezers. We looked this up. The vaccine efficacy after only one dose of Moderna is huge, 80%. Pfizer, 52%, which is still higher than Dr. Fauci said is the goal at the beginning of this. Why is the state not doubling the odds of people like Jodi's in-laws and just injecting every dose we have and then going to the federal government and say, we need more?
It's a major problem. And again, I don't have that answer. And many of my colleagues, all of my colleagues in the legislature don't have those answers as well. And that's part of the communication problem I'm really talking about. Someone, you'd expect someone like me would have these answers. I just want to go back to what Jodi was saying. And Jodi, I'm glad your family's getting the vaccine here. But this is a huge problem, not only just from a fairness perspective, but when we actually look at public health and how we're actually going to contain the pandemic. If we don't reach the most vulnerable people in our communities, then COVID-19 isn't going to be like something like the flu. It could be like something like HIV, right? Where we've been able to contain it among, my community, right? If you look at middle-class men who have sex with men, gay men, right? We've contained HIV there. If you look at HIV transmission rates among Black and Latino men who have sex with men and among IV drug users, they're alarmingly high, right? That's the predicament we could get ourselves in with this vaccine if we don't address these equity issues.
Jodi, back to you before we go. Who got to notify the in-laws of the good news?
I got to do a great big family group text, and they are delighted.
Oh, great. And how did they react?
They're like, what? Did you have to pay or kill someone to get this?
Well, I have to say, thank goodness there are people like you, but I think all three of us would agree there shouldn't have to be people like you. So We hope everybody else has the same good fortune your in-laws do. Jodi, good to meet you. Senator, it's good to see you as always. Thanks so much for your time.
Thank you, and have a great evening.